Thank you, Dr. Wilson. I hope everyone can hear me right now. And so it's 6:10 in Bahrain, so good evening from Bahrain. And like Dr. Wilson mentioned, we're from Charis Educational, and we operate under the umbrella of Charis, a multi-specialty veterinary practice in Bahrain. And we specialize in orthopedics, neurology, ophthalmology, gynecology, and laparoscopy. And particularly for this year, 2024, as Charis Educational, we aim to provide educational as well as training, hands-on training for various courses. We just finished with one of our first courses for this year, which happened on the 2nd of February, which was for first aid, pet first aid program, and it targeted especially for pet owners as well as for veterinary assistants or kennel assistants that took part. We will be having some material going out on our social media, so stay tuned and have a look at our program which just took place this month. And and we're here right now to host the webinar with STIF Pet Care, and we have Dr. Labro and Ms. Romain, as well as Dr. Pages, who is on this webinar as well. I will take you through a little bit brief about us as well, and we will have the rest of them conveying their part as well about STIF Pet Care, about the webinar. So I believe about the webinar, if I was to mention, it's we're focusing on learning how to practice the CCL reconstruction technique. And like we mentioned, this is it's a free, it's a ligament repair, and which is our focus, and the expertise would be Dr. Labro, who would be sharing his expertise on this. His background comes as from orthopedic surgeon practicing for humans, and in 2010 this practice is brought into veterinary medicine as well, with the help of Lars ligament, now in animals. And he will guide you in terms of how we can implement this in animals. The practice is already going on, but for this part of the region, we are focusing on the training so that, we could expand this. I mean, we can share this knowledge with you, and for the rest of the doctors who have joined for today's webinar, can also have the knowledge to do this practice. And we can guide you in terms of how these materials can be sourced for any future practice. In terms of the scientific committee from STIF Pet Care, we have Dr. Labro, we have Romain, like I mentioned earlier, we have Dr. Shellos, Dr. Pages, and Dr. Manhas, and we have three of them. To my knowledge, there's three of them currently in this webinar. And yeah, so that's from STIF Pet Care. Followed by that, sorry. Yes, and I would like to introduce the scientific committee from Charis Educational. We have Dr. Wilson, who helped with the introduction. So that's Dr. Wilson for everyone. We have Dr. Hansel here. Dr. Wilson, like you mentioned, he's a specialist with orthopedics and neurosurgery. Dr. Hansel focuses on laparoscopy and gynecology. We have Dr. Melvin also here, joined us in this webinar, who also practices at Charis Educational, and his specialty is ophthalmology. We have Dr. Grishma as well, who is a specialist in veterinary microbiology as well. That's from Charis Educational, just to give you a glimpse. And in terms of the agenda for today, we're done with the introduction from our side right now. I will be handing it over to Mr. Romain from STIF Pet Care to give you a background about the company and in terms of and a glimpse into today's webinar will be shared by him. Followed by that, we'll have Dr. Lebro giving in the theory session about the ligaments and the practice in general. And after our theory session, we will be discussing in terms of the hands-on certification course. I think like we had mentioned earlier as well, this webinar is to be followed with a hands-on program, which we have scheduled for in April. I will talk about this after our practical session to give you more details about it. And towards the end, we would have a Q&A session. So if you have any questions, please mention it on the chat box. And based on the priority of the questions, we'll have some of them answered during today's webinar. And if your answers are not answered today, please feel free to send in the questions to the email education@chariswets.com. I will mention it here as well. And you can send in your questions and we'll get back to you once we have the answers individually. So over to you, Romain.
I will do it very quickly because after we have a presentation which will be more detailed. Just to give you a rough background of STIF pet care, Dr. Laboureau is also the founder of the LARS, as you mentioned before, which is used in human being. STIF was founded in 2010, and during 7 years, it was dedicated to research, development of the adaptation of the implant to the dog, to the veterinary field. Dr. Pages was one of the first ones to perform the technique with Dr. Laboureau. He participated to the previous work on it. And during all this phase of mechanical tests, clinical trials, etc., the ligament was studied and a little bit modified. The technique also was modified to arrive at the final product and technique in 2018, date of the release of the ligament on the market. STIF Pet Care is the commercial brand of the ligament. We have now more than 4,200 surgeries done around the world. I will not say much more for now, because if I say everything now, Dr. Laboureau will have nothing to say more. So I will.
Always pleasure, my friend.
Yeah, perfect.
Salam alaikum to all of you. And I am very happy to present this technique to you this evening. The intra-articular reconstruction has been adopted since a long time in human surgery. But in human surgery, we use autograft or allograft and synthetic ligaments. We have the choice. But for animals, next. The problem with autogenous transplant is that they are mechanically efficient only after a long period. It takes about 30 weeks to recover a significant mechanical efficiency. So we can ask humans to be quiet for 6 months, but it's another problem with dogs. This is why for dogs, it looks like as long as you want to make an intra-articular reconstruction, you have no other choice than to use synthetic ligaments, which are strong from the very first minute. The first ligament, as Romain mentioned, were the last with the 3 fibers. So the advantage of intra-articular reconstruction is that you recover immediately a normal biomechanics of the knee. But the main thing was the ligament had to be adapted to what is happening in the knee. Of course, the ligaments are submitted to tension and flexion, but the worst stress is torsion. You can understand what I am talking about torsion. You see here what it looks like in extension. The ligament is made of two main fibers, the anteromedial fiber and the posterolateral fibers. So you see their position when the knee is in extension. But when the knee is flexed, there is a complete torsion of the femoral attachment. So every time you go from extension to flexion or vice versa, the ligament has to rotate completely. And this is an enormous stress for synthetic material because it represents millions and millions of cycles of torsion. You see that if you don't use special cleaning process, then very soon all the fibroblasts they die, as you can see on the white curve here. We had to work on a cleaning process to make the fibers absolutely biocompatible, and that was a lot of work, I can tell you. But finally we did it because now you see that the fibroblasts, they can grow as before the cleaning process, they were all dying. So that was the in vitro culture. You see, we implanted fibroblasts in between the microfilaments of the ligament. You see that slowly they invade all the space in between the microfilament of the ligament, and completely after 48 hours. You see here a biopsy of a ligament. So this is a fiber made of multiple microfilaments, and you see that there is an invasion of collagenic tissue all around and inside. You see, this is a fiber, and inside the fibroblasts, they come and they grow. So back to anatomy. You see that each main bundle of the anterior cruciate is not isometric. You can see this from this drawing, but the center of the ligament is isometric, and is the center of a circle, arc of a circle, which is the posterior condyle. So in each position, by definition, the center of the circle is isometric. And this is where the ligament must be attached. And it is the same story, whatever the position of the knee is. So we have to aim to attach the ligament exactly at this point, which is absolutely constant in each position. But of course, we had to adapt the first ligaments to the dogs, meaning they have smaller bones, so we have to make smaller tunnels. We have to be more resistant because of the speed of the dog. For a human being, it takes 2,400 joules, more or less. But it needs much more for a dog, which is running. For the dogs, you need a much more resistant ligament than for a human being because of the speed. Of course, the dogs, there is a big variation in the size and weight of the dogs, much more than in human beings. So for this, we had to make different ligaments.
These are the tests that were done on the synthetic ligaments on veterinary field. All what was done in human being, we remade it for the veterinary surgery. So these are the mechanical tests of the ligaments. and the results are even better.
It was measured that after millions of cycles, there is no elongation of the ligament, a very, very small, negligible difference. These are biopsies which have been made in dogs after surgery to make sure that there is really a fibroblastic ingrowth inside the ligament, and you can see that many fibroblasts are growing inside the ligament for dogs like it was for humans. These are the instruments. This is the guide. Sometimes it is useful. The first step of the operation procedure is to put a key wire at the right position in the lateral condyle. So for this, you have to pass over the tibial insertion of the cruciate to make sure that the ligament will be centered into the intercondylar notch, and there will be no friction with the wall of the notch. And the best way to make it is to go over the tibial attachment. So the key wire is exiting the lateral condyle, and from the femoral tunnel, you can drill the tibial side of the tunnel. This is the best way, but it does not work always so easy. So sometimes you have to drill in two different steps, the femoral tunnel and the tibial tunnel. If you cannot reach in one step from the femoral tunnel the tibial attachment, you can easily, in a dog in hyperflexion, go directly to drill your tunnel from the tibial plateau. And this is most commonly done. So when the tunnels are done, you you replace the drill bit by a tube. Inside the tube, you insert a metal wire loop, which allow you to attract the ligament, to pull the ligament through the tunnels, and taking care of having the free fibers in the intra-articular part. Then the next step is to fix the femoral side with the interference screw, and then you control the isometry. And if you are not perfectly isometric, you better fix the ligament in such a way that the full motion is guaranteed. For a strong fixation, immediately strong fixation, which is absolutely necessary for a dog, you have to drill secondary tunnels transversal to the axis of the bone and put another screw here. So that makes a very, very strong fixation, allowing immediate full mobility and activity, like this. So you see, this is the primary tunnel, this is the secondary tunnel, and you see that the ligament is in the right position, and the tunnel arrives just at the center of the circular. When you see a post-operative X-ray is absolutely mandatory because it allows you to know exactly if the operation has been made forever or if it will break sooner or later. At least you have to wait a little bit to make sure that the wound is perfectly healed before you allow the animal to run everywhere.
On this study, there are three failures. The two primary failures are the rupture of a sliding of the ligaments, because in 2012 there was only 2 screws put in the bony tunnels, and as the dogs, you can't control them like a human, and they sometimes feel well, so they start to run, and there was this mechanical problem of maintaining of the ligaments. So this is why we now put always 4 screws, to be sure that in any case the ligament will be at its right place, and that the free fibers will stay centered into the intra-articular zone. 2 owners were able to compare the technique with the TPLO, which was previously performed on the knee. So they were very happy with this technique, especially on the post-operative period. The average weight bearing is around 3 days, and for big dogs, of course they need more their force power than a small dog, so the weight bearing is coming back more quickly. Sometimes directly after going out of the clinics, the dog is not in full weight bearing, but they are able to use their paw. And the estimated complete recovery is around 1 month.
The only complication we had was infection. Just to insist on the fact this is an intra-articular surgery, and a sterile procedure is absolutely mandatory. You have to be very careful about sterility during operation. From the very first step, I mean the preparation of the skin by a large shaving, removal of all the hair, cleaning of the skin, using proper instruments. And apropos proper instruments, I have seen some complications. They were just due to the fact that the nurses, they don't always take enough good care of the instruments, because it's quite difficult to clean the cannulated drill bit. It is quite difficult to clean inside the tubes which are used to pull the ligament inside the tunnels. So this is extremely important to insist on a very sterile procedure. The feedback we have from all over the world where the ligament is used is absolutely similar to our own studies, and globally, owners have the satisfaction of 98%, and good results, good functional results are 95% all over the world. You don't create any irreversible situation. You don't cut bones. You don't destroy anything. You just replace the ligament which was damaged. That's it. And this is a big advantage of this technique. You don't burn the bridges behind you. The duration of surgery is perfectly acceptable, about 40-45 minutes, depending of your own experience. After many operations, of course, you go even faster than this. But and it is interesting to go fast, because the only thing which is very dangerous in surgery is to open. The faster you operate, the less complication you have in terms of infection. Of course, the best technique to do this, but for the time being, it's a little bit too early, because arthroscopic technique is not so. I don't know how it is in your own country, but in Europe, not so many vets are operating under arthroscopy. But for sure, arthroscopy is the future of this technique, which is ideal for this type of procedure. Thank you very much for your attention.
Thank you so much, Dr. Lebro and Romain, for sharing all the information for today's webinar. I hope everyone who's attended this understands how important it is to understand this technique and to help your patients. So just to give you a recap, in terms of the upcoming webinar, in terms of the upcoming workshop that we plan to have in April, we aim to have the event for 24th of April. It's a one-day program happening at the Conference Center for Training and Medical Research. The registration link is here, but you can also use the QR code to scan for more information about the webinar as well as to register. You will find all the details that Dr. Wilson has mentioned earlier with regards to the accommodation, with regards to the venue, as well as for your visa requirements. So have a look at it, and if you have any questions, please feel free to email us on education@charisvets.com, and we will get back to you with anything. Even if you have any further questions that you may not have asked today, but you have in the coming days, do send it to us, that so we can get back to you. Also, just to give you an idea in terms of what we plan to do on the day of the workshop. The day is divided into two, where in the morning we have a theory session similar to the topics that were addressed today during the webinar. And the second half would be a practical session wherein the procedure is shown on cadavers. But I just wanted to emphasize was that as much as it's on cadavers that is usually done, we aim to also have it done on live animals. And we hope that when the event is planned for, we have about 1 to 2 animals ready for performing this technique on them. So this will be definitely a hands-on workshop for anybody who's planning to attend it. And for those who are here, and if you would like to pass on the message, feel free to share the link that is mentioned here. I have also put it up on the chat box in this webinar as well. The email as well as the link for registration and information. But if there is anything else that you would like to add, or you have any queries, you can always get in touch with one of us, and we'll be happy to assist. I believe with that being said, we conclude with today's webinar. So thank you once again, and we hope to see you all at the workshop.